Hello friends, my name is Maria Luisa Tobalino. I'm a health communications student at BYU Idaho and I welcome you to You Matter. This podcast is made to freely speak up about mental health issues and how important it is to reach for help. In this episode, we'll talk about healthcare providers' emotional distress due to the pandemic, what are the symptoms and where to find help. COVID-19 has taken thousands of lives and is still causing so much damage among all kinds of populations. The vaccination hasn't been totally effective because even with it, the infection keeps spreading. With all the restrictions and protocol displayed along this time, many has been feeling trapped, confused, and lonely. These events meant a lot of stress and the damage of mental health. According to Betty Betterbaum, Director of the Terrorism and Disaster Center in the College of Medicine at Oakland University, healthcare providers are particularly vulnerable to emotional distress in the current pandemic because of the constant exposure to the virus, long working hours, and increased workload. The prevalence of depression and anxiety among healthcare workers are 22.2% to 33% worldwide due to the pandemic. And females show higher rates of affective symptoms compared to male and medical staff, respectively, according to the medical journal Brain, Behavior, and Immunity, published in May 8, 2020. A cultural belief about health providers is that they must be prepared for every circumstance and hold against the impossible because they are the only one who can help. That's a lot of pressure on their shoulders, and made them believe that if they miss, the situation can get out of control. If you are feeling exhausted, detached, unable to focus, depressed, burnout, and anxious, it is time to ask for help. Julia, a nurse in the Central University Hospital, has been discharged of her duties because of her symptoms of anxiety and depression during the fifth wave of the COVID-19. She said, "I was not able to smile, to think clearly, to sleep, even to hang out with my 12-year-old daughter when I came home from work, because I felt powerless against this disease, and no matter what I do, it's not enough." Healthcare staff may feel like they don't have time or are too busy to focus on finding help for them about a health-related issue. Sandra is a 40-year-old health provider in a nursery. She lives in Gijón with her 2 children and works in a non-governmental institution taking care of elderly people. She works 9 hours a day from Monday to Saturday. At the end of the day, Sandra arrives home to take care of her kids. She is often tired and feels like she needs vacation to relax, but she must keep working because there are no enough professional workers in the institution, and her workload has been increased significantly. Also, her economy is low and cannot afford to lose her job. She is experiencing stress and exhaustion, but she thinks that looking for help is going to take her a lot of time and means an unnecessary expense. Many cases such as Julia's or Sandra's happened all the time, but mental health is put aside because of the lack of professionals in the field and work overload on them. Because a healthy mental state reduces risk of depression, increased self-esteem, gives a greater sense of calm and inner peace. Looking for mental health is a must nowadays, and even more for those who are dealing in the front line of the health system. Don't let COVID-19 take your mental health. Talk to a supervisor about your concerns and find help, or call the Mental Health Confidential Hotline for a free consultation at 722-814091. That's been all for this episode. Thank you for your time, and remember, you're not alone in this hard moment. For more information, get to www.youmatter.com. Until the next podcast, bye!